Once again, hello, good morning, good afternoon, good evening, wherever you may be joining us from. My name is Karina Ivanyan. I'm an intake advisor at the International Students and Programs Office, also known as ISPO here at UC San Diego. ISPO is one of the 4 units in the Global Initiatives Department, which includes the International Faculty and Scholars Office, Study Abroad, and Office of the Assistant Vice Chancellor of Global Initiatives. And today we will be talking about student health, such as insurance and immunization requirements. As I mentioned, my name is Karina Ivanyan, and I'm joined by a few of my colleagues. So I'm going to pass it over to them to do some introductions as well.
Thank you, Karina. Hello, everybody. My name is Gabi Hoffman, and I work alongside Karina here at the International Students and Programs Office as the Assistant Director for Student Experience and Engagement. And we're very excited to have you join UCSD this fall. I'll go ahead and pass it along to my colleague, Jill.
Hi there, my name is Jill Batika, and I'm the Billing and Insurance Manager for the Student Health Center on campus.
Hi, my name's Annie Horton. I'm the Director of Nursing at Student Health Services on campus.
Thank you all for your introductions. Before we start with the content of the webinar, we're just going to go over a few housekeeping things. As a reminder, you are in listen-only mode, which means you can hear us, but we can't hear you. You can also ask questions throughout this webinar using the Q&A feature on your screens. If by any chance we haven't had a chance to answer your questions during this webinar, please don't hesitate to go to icontact.ucsd.edu to connect with an ISPO advisor. And lastly, we are recording this webinar and it will be available on inewstudentwebinars.ucsd.edu in the next few days. So if you'd like to review some of the content again, please don't hesitate to go there to see the recording. A little bit more about that Q&A feature. So it should be appearing on your screen somewhere on the top or the bottom, and you can type in your questions. You can also send them in anonymously. We'll monitor the questions and we'll do a live Q&A session at the end of the presentation. But our presenters will also, if there's any questions, during the session, we'll also answer them throughout. So please keep an eye on that Q&A feature, and we really love to answer your questions, so don't hesitate to submit some. In terms of agenda, we'll quickly go over some of our first step checklist reminders. And then we'll transition into talking about student health services and immunization requirements. We'll review some of the other upcoming webinars, and then we'll do a live Q&A session. And with that, I'm going to pass it over to Gabi.
Great, thanks, Karina. Yes, let's take a few moments just to review the ISPO website and specifically our first steps checklist. So the first steps checklist is designed specifically for international students to help you through the process of getting started here at UCSD. If you go to inewstudent.ucsd.edu, you'll see it will take you to our newly admitted international students page where you can click on your student level. So in your case, this would be for undergraduate students. As an undergraduate student, then you click through these various different steps. You can see here, it starts with requesting your immigration documents. So either your I-20 for the F1 or DS 2019 for the J1. Then it will walk you through steps on preparing for your arrival, things you need to do before you get to campus. And then it will walk you through steps to do upon arrival when you get to UCSD and how to get settled in and so forth. All right, with that, I will go ahead and pass it along to my colleagues.
Thank you, Gabi. Again, this is Jill Batika, and I am the Billing and Insurance Manager here on campus at the Student Health Center. I'm going to provide you with some information about the health insurance requirement for the school. Let's start out by letting you know what SHIP is. SHIP is an acronym for Student Health Insurance Plan. Over 20 years ago, the UC Regents decided that in order to protect our campus and the students residing and attending our campus, they would require that everyone have comprehensive health insurance that meets an agreed upon criteria set up by the Office of the President through UC. As many other universities and colleges do, they decided to add the health fee as a non-academic requirement to the registration fees paid by every student. The health fee may be opted out of by successfully completing a health fee waiver on the Triton link during the open timeframes. Those that don't opt out will be automatically enrolled in SHIP to ensure that they have adequate coverage while attending the university. Our enrollment in SHIP is coordinated by a third-party brokerage. It's key to register timely so you're eligible when the quarter starts. All UC students are welcome to use the Student Health Center and will be pair classified as SHIP, RAFT, or fee-for-service, or an international student that attends through our UCSD School of Extension. This year, our premium for undergraduates is going to be $753. Before the presentation, we didn't have an exact premium, but we do now. So again, that's $753 per quarter. Next slide. If students want to avoid paying the registration health fee for the health insurance, they need to file a health fee waiver timely for consideration. All students must have comprehensive insurance that meets the UCOP waiver criteria in order to be approved. Students must renew their health fee waiver each school year, and we do not accept late waivers or requests for retroactive waiver applications. This year, our waiver time frame for fall is May 3rd through September 20th, so you have ample time to get on your Triton link and look at your opportunity to waive or to find out more about the insurance. We do not accept international plans to waive the insurance offered by the school, but there are these 3 plans that have been approved by the Office of the President that you can purchase online. You just have to make sure that you're active for the entire school year and then file the waiver timely. These are all found online and they will give you the benefits if you want to take a look at those URLs. If you do keep the SHIP coverage, here are the benefits you'll receive. Students that participate in SHIP, your primary care physician clinic is on campus. This is where you should start care if you're sick or if you want to have a preventative visit. We offer preventative services, and most of our services are very cost effective, especially for vaccines, lab services, and pharmacy services. Availability to see a provider is usually pretty good, as we don't see the public or staff or dependents. Dependents on the student health insurance plan go to primary care physicians in the community. All UC students are welcome to use the Student Health Center on campus. We don't hold contracts with insurance companies other than the SHIP carrier, so we cannot bill your home insurance company for services. Students that don't keep the SHIP or opt into the RAFT offering may use the clinic on a fee-for-service basis. They'll pay for their services upon discharge, or the fees will be transferred to your student account. Upon request, we can provide a printout of detailed itemization receipts that a student can use to seek reimbursement with their own insurance company. We're open all year round and during school breaks, and we're open until 6 p.m. on Mondays. Please call our clinic or go online to My Student Chart to schedule an appointment. For students needing further medical direction during our closed hours, please call our main line to speak with a registered nurse that can assist you. No matter if you keep the SHIP, RAFT, or you're paying out of pocket, they can assist you. This is a picture of our clinic. We're located on Library Walk, right across from our Price Center food court and the student school bookstore. Students from other UCs may visit our clinic, and our students may visit any of the UC student health clinics throughout the state of California and receive the same benefits. To get a copy of your insurance card, if you do keep the SHIP, please download the app Sydney on your phone or mobile device. This app will provide you with a copy of the front and back of your insurance card, and this will allow you to view claims that are processed under your subscriber identification number. The app also allows you to look up providers and facilities that are contracted with Anthem Blue Cross, the insurance company. And we do try to stay ecologically minded, and we don't send out hard copies of your insurance cards. So it's very important that you do download this app. Students on SHIP that receive a referral to a specialist or hospital-based service have 3 tiers of benefits to choose from when deciding what provider they want to see. The first tier of benefits is the UC providers and facilities. If you go see a UCSD specialist, it's less out of pocket and there's no deductible that applies. In San Diego, we're lucky enough to have 3 comprehensive hospitals in our neighborhood, and we have over 300 specialists that are available to the community. Everyone is on the Epic MyChart, so providers can see medical records and any services that you've received at Student Health. The second tier of benefits is the Anthem Blue Cross PPO network. This will cost you a little more to see a specialist, and there is a $500 deductible for any diagnostic or hospital-based care. A deductible is what's paid first by the patient, and then the insurance kicks in and starts paying either full or a percentage of the charges. The third tier, we strongly discourage students from using, but if you must, you'll pay a $1,000 deductible and 40% of any remaining bills. Most out-of-network providers expect payment up front, and then you would seek reimbursement with the insurance company directly. As part of the SHIP plan, next slide, you do get a supplemental benefit for dental coverage. SHIP coverage extends beyond medical care, and you'll receive a limited coverage under dental and vision. We don't have dentists on campus, but we have many in the surrounding community that accept Delta Dental PPO. To find a dentist, you would call the 800 number or go online to find providers in the zip code that you're in. They provide you with $1,000 worth of curative services. And then we also provide a supplemental vision coverage. For those of you that want to get an eye exam, we have a comprehensive optometry suite here on campus in the Student Health Center. The insurance offers, they pay an eye exam, you pay a $10 copay, and they also provide you with $120 to put towards frames and lenses for glasses or contact lenses once per benefit year. To find optometrists outside of the Student Health Clinic, you would again call the 800 number for Anthem, and then you could also go online and search for providers based on your zip code. There isn't a referral required for dental or vision, but referrals are required from our primary care physicians here at Student Health for any specialty service or hospital-based service other than emergency room and urgent care. We don't process retroactive referrals, so it's key that you call us and speak to a provider or see one of our providers in person so you can achieve that referral. I'm going to leave you with some resources if I didn't answer your question here that maybe you can tap into later. These are the contacts for the insurance companies for our office here at Student Health, and also some offices at the UCSD Health Center, which is right across from our campus. We offer telephonic information as well as offer virtual meetings. So you can do a face-to-face encounter with one of our insurance coordinators by dialing into Zoom on Monday, Wednesday, or Friday. Thank you for letting me have this time with you, and I will answer any questions that you have here. And if you think of anything later, please either email us or give us a call and we'll be glad to answer you. And I'm going to hand it off to Annie Horton, who's going to give you the incoming health requirements.
Thank you so much, Jill. And yes, as Jill said, I'm Annie Horton. I'm the Director of Nursing, and I oversee the UCSD incoming health requirements, which includes TB, immunizations, including COVID-19. Why we have these requirements is really for protection for the entire campus community. You have seen with COVID-19 just the huge impact of health outbreaks, and so all of the vaccines that are required and the tuberculosis screening is very much aimed at illnesses and diseases that are spreaded through respiratory contact, and so we try and prevent as many vaccine preventable illnesses as we possibly can through these requirements. As I said, our incoming requirements include tuberculosis risk screening, which every student is required to do. That includes transfer students, readmitting students, and students transitioning from undergraduate to graduate. We also require testing if your risk is higher. And for many students coming from overseas countries, we do require TB testing. We require some regular immunizations, which includes Tdap, measles, mumps and rubella, varicella, which is chickenpox, and meningococcal vaccines. We also have a space for students to add all other vaccines that they may have received, such as polio, hepatitis B, hepatitis A, and we love you to enter as much information as you have, because it really helps us when we are, if we become your primary care providers, and especially if you choose to go on any of our study or university study abroad affiliated programs, it really assists us in that. The COVID-19 vaccine is a new requirement or mandate that we have, and that presently involves the primary series. And the deadline for all of these requirements is presently set at July 10th. So starting the process, you'll need a UCSD Student AD login, which is a UCSD email and password, to be able to set up the student portal facing part of EPIC, which Jill referenced. And that is called My Student Chart. And that is where you communicate with us. That is where you enter your vaccine dates. It's where your TB risk screening questionnaire is housed, but you can only access that once you get that UCSD email. Until then, it will look to you as it does to a member of the public, and you will not see any of the places where the incoming requirements are. All of the information regarding this and links to setting this up is on the Triton checklist, or it's now called the enrollment checklist. And this is what it looks like. It provides you with the deadline date, and then it goes into each of our requirements, starting with the immunization and then the TB risk screening questionnaire. And the blue highlighted links will take you to our website, to the forms, to messaging the nurses here. And then the next part of it is the COVID-19 vaccine mandate. And here I've listed all of the presently approved vaccines and hopefully all of their various names. Now, this is a bit of an evolving list. Presently, though, you will be able to enter these vaccines in yourself. If there isn't a space to enter your specific vaccine, it's because it hasn't yet been approved. To enter this information is in a slightly different place than the other vaccines. It's got its own devoted COVID-19 page, and a big advantage of putting that in first is that you're able to trigger what is known as the California Immunization Registry, which will pull in information from other parts of California if you received a vaccine in Northern California or you went to school in LA. It also will pull in information from other sources that use EPIC. So if you were in any other part of the US and had healthcare that used the EPIC platform, it will also pull that information in, not just the COVID-19 vaccines, but actually any vaccine that you've received. So it's a huge advantage, and it cuts down on the amount of work that you need to do. This is what it looks like once you're able to access My Student Chart. The best way to find most things is by going to the menu and then scrolling down to immunization and screening. There is another section which isn't displayed on the screen that says COVID-19, and that's where you enter those vaccines, but it's very easy to find, and it takes you to a landing page. On that landing page, you'll see the requirements, the TB screening, and if you hit start there, it'll take you to the questionnaire. You complete the questionnaire, and the questionnaire determines if testing is needed, and you'll get a little pop-up that says, thank you for your submission. Please take this form, and it provides a link to the form to take to your healthcare provider to get TB tested. And the second one is the immunization history screening, and that is where you're able to enter all of the dates of the vaccines that you've received. And this is what it looks like in the immunization screening fields. The required vaccines, they are all listed there. If we already have a particular vaccine on file for you, it'll say complete and it'll say the date that you received it. If it isn't on file, there'll be some blank boxes for you to fill in the dates that you received the specific vaccines. There are additional boxes available for you in case you've needed a booster, or in your country you received more doses than perhaps is recommended here. It's by no means does that represent what is required. If you hover over the little eye bubbles, it'll give you information for what exactly is required, and give some clinical information as to the spacing of those vaccines. The TB risk screening questionnaire is a series of 5 questions that you answer, and if you're prompted, as I said, you move on to the next phase, which is TB testing. The types of TB testing that are accepted by UCSD includes skin testing, which is one of probably the most common forms of testing, and the other two, one of them is IgRA or quantiferon, which is a blood test. In some countries it's called a T-spot test. Those are all acceptable. In fact, it's kind of the gold standard of testing. So if you do have access to that form of testing, please do select that preferentially if your provider is making that available to you. If you have received a BCG vaccine, which is a TB vaccine that is provided in countries with higher than usual risk for TB, the preferred method of testing is the blood test. If TB skin testing or the blood test is not available to you, we will accept a normal or negative chest x-ray, and we do require that you upload the actual chest x-ray report with your testing form, so that we can read that and really take a look at what the radiologist is reporting. A registered nurse will see your uploaded testing results and will reach out to you if any additional testing is required, or if they have questions, or there's some detail missing that we require. That is really important to go back and check your messages quite frequently. And please do keep checking those messages, because sometimes we can't clear your submission, and you might just be missing a very small detail, and you would receive if it's not fully cleared by the time the academic holds go in place, then you may receive that, and it could have been resolved very quickly with just a little bit more information. The immunization deadline is exactly the same, and you need to obtain your vaccine records. And for many of you, that might be from your healthcare provider, it might be from your high school, it might be from another learning institution that you've been to. It can be in a variety of places, but I would encourage you to get onto that early, because sometimes there are delays in obtaining those records. If you can't obtain your records, you can download our immunization form, and on that form it has very clearly outlined exactly what each immunization requirement is, and it really will help your healthcare provider to guide them in exactly what is needed. And if there is no record, for example, for varicella or MMR, it indicates that you can actually get a blood test or a blood titer to show immunity instead of having additional vaccines. And again, just attend to this as early as you possibly can. The COVID-19 vaccine mandate is required by all of the UC schools, as are all of these requirements. And presently, it's just the primary series that is mandated. That primary series needs to be FDA or WHO approved vaccine. We are highly recommending that a current booster is obtained, and the current boosters that are available are the bivalent boosters, which cover the more current variants that are circulating in the community. Those are available once you get to the US. And if you have received a non-WHO approved vaccine, you will be able to access FDA approved vaccines quite easily in the US. These are all covered by US insurance policies, and we do have them also here at Student Health in our nurses clinic. Medical and religious exemptions are available for the COVID-19 vaccine, and temporary postponement is available for pregnancy or disability. And as I said, the vaccines are very freely available in the US. And how to get help. The best way and the quickest way to get help is by sending a message through your My Student chart to Ask a Nurse. And we have a large team of nurses and medical assistants here at Student Health that are responding to those messages almost 7 days a week. There are folk answering those questions also out of hours as well as in the weekends and holidays. And we really try and turn those queries round in around 24 hours, give or take a little bit. But you can ask us any questions, and there's always usually someone available there to provide information. I have provided an email here too that links to our medical records department. That is only for technical difficulties. For example, you may not be able to easily sign into your My Student chart. That would be where you would go. They would be able to walk you through that. There are also instructions on signing up for My Student chart on the Student Health website, which is presently being updated to reflect all of our changes. That update is due very, very soon at the beginning of May with all the appropriate links. But any technical difficulties, you can use this email. And as I mentioned, we have a student health website. The graduate division has a website. And also the university has a website devoted to COVID-19 related information called Return to Learn. And that does house a lot of information about the vaccine mandate. That is slowly being sunsetted now that we are through the worst of the pandemic, but it will still contain information there. And as I said, please go back to your My Student chart messages from our team so that you can answer any other questions that we have. And this is a photo of our nursing team, and these are many of the folk that will be helping answer your questions, and please do feel free to reach out to them at any time. And as I've mentioned, really, we want to avoid you having an academic hold placed for failing to do these requirements. So we really are here to facilitate the process as much as possible and to make sure that you are able to get these requirements done in a timely manner. So thank you very much.
Thank you, Annie and Jill, for this helpful information. At this time, I would like to encourage our participants to submit their questions using the Q&A feature. And before we transition into our questions and answers session, I just want to share a few opportunities with our students on how they can get engaged on our campus. First one is ISPO specialty programs, also known as I programs. And so our office hosts quite a few of these to facilitate connection between students and make your transition to campus life a lot easier. And so if you're interested in kind of learning about any of these, I would encourage you to check out iprograms.ucsd.edu. Some to feature, just to mention a few, would be our English in Action program. So this is a conversation program where we partner participants with native speakers. And it's a great opportunity to participate in cultural exchange and practice your conversational English. We also have coffee hours, which is one of our most popular programs. This is designed for students to join us in our space, so right outside of our office. There's usually coffee, pastries, and games, and students get to connect with one another, but also meet ISPO staff. And then again, if you're curious and kind of learning about any of these other programs, please go to iprograms.ucsd.edu. One of the programs I would like to talk a little bit more in detail about is our International Peer Coaching Program. So this was designed specifically for international first-year undergraduate students. And so every college has an international peer coach. As you can see, we currently have 7, but moving forward into the new academic year, we will have 8 peer coaches. And so they're there to support you. You can meet with them one-on-one. You can also attend some of the events that they're hosting. So if you're curious to kind of learn more about our peer coaches, please visit ipeercoaching.ucsd.edu. They're also on Instagram, so do check them out there as well. Another peer mentorship program that we offer is our Global Ambassador Program, also known as GAP. And this is a summer-long peer mentorship program specifically for our undergraduate students. And this actually, this program is designed for both international and out-of-state students. We're still working on releasing some of the application information, but if you'd like to connect with a current UC San Diego student and kind of learn more about their experience, but also just kind of have questions and would like to build that relationship before arriving to campus, GAP may be for you. And you can learn more about it by going to gap.ucsd.edu. I also want to highlight our iEvents calendar. So this is where ISPO, as well as some of our campus partners, will add different events going throughout campus. Usually these events have a global focus, and so it's a great opportunity to, again, find something that you're interested in, find your community, and kind of stay in touch with other Tridents. So if you're interested in learning about our iEvents calendar, please visit ievents.ucsd.edu. We're also pretty active on social media. This is where we'll oftentimes have giveaways or important updates. And you can always, kind of connect with us on Facebook or Instagram. We're also on YouTube and LinkedIn. And so please follow us at ispo.ucsd. A quick reminder about some of the additional resources and upcoming webinars. As Annie mentioned, returntolearn.ucsd.edu is a great place to get any information in regards to COVID-19. So if you are interested, please go ahead and check it out. In terms of some other important deadlines and reminders, now is a great time to start requesting your visa documents via iPortal, and you can access the webpage by going to iportal.ucsd.edu. We're going to have another webinar this week on Thursday, April 20th, that will cover undergraduate housing. And as always, if you're interested to register for our webinars, or if you'd like to watch the recordings later in the future, please go to inewstudentwebinars.ucsd.edu. May 1st is the deadline to accept your admission. So make sure that if you have decided on attending UC San Diego, you submit that acceptance by May 1st. We're going to have another pre-arrival webinar coming up in May. And then in September, we're very excited to welcome you for our new International Student Orientation. We're still in the process of planning something, so we're not going to spoil anything for you just yet. But if you're curious to learn more about our orientation, please go to iorientation.ucsd.edu. And these are, again, some of the upcoming webinars. So the housing, we have one on CVS transfers. So if you have attended a school in the United States and you would like to transfer your CVS record, we have a session specifically for that. We'll also talk about finances and student accounts, campus safety, and student life. And all of those will be available on our inewstudentwebinars.ucsd.edu. And with that, we're going to transition into our live Q&A session. It looks like we have one question already, but please don't hesitate to submit those throughout the time. And Jill, it looks like you have marked the question, so I'll pass it over to you.
I am actually going to give that to Annie. So it's important for the immunizations to be filed through my student chart. So I'm going to turn that over to her.
Thanks, Jill. Yes, it's a really good question. We load all of our students into EPIC, which is our electronic health record that has My Student Chart attached to it. New students are not loaded in until the beginning of May. And so please just check back between May 1st and May 15. And once you are loaded in, you will be able to have access to all of the appropriate links to do the immunization and TB risk screening.
We're just going to give it a few more moments. I know sometimes typing those questions out can take some time, but please, if you have any questions for Amy or Jill or for ISPO, don't hesitate to use the Q&A feature to ask us. We really love answering your questions, so we hope to get as many covered as possible today. So it looks like we just got a question, which says, if I have already had 2 COVID vaccines, do I still need a booster? Any?
It is strongly encouraged, but not required.
And also, as was mentioned during the webinar, you can always get those on campus as well. We're just gonna wait for another minute or so, just to allow for all of the participants to submit their questions. But in the meantime, I would like to remind you all that if you're interested in learning more about next steps, especially as it pertains to requesting your immigration documents, please don't hesitate to check out inewstudent.ucsd.edu. As Gabi mentioned at the beginning of the presentation, you'll need to choose undergraduate student one, and then it'll cover all of the different steps that you'll need to take prior to arriving to UC San Diego. You can also connect with our office by emailing inewstudent@ucsd.edu or going to icontact.ucsd.edu, and we are available Monday through Friday to support you. Okay, it looks like there are no more questions in the Q&A feature. Thank you all so much for joining us today to talk about student health. As always, if you have any questions after this session, please don't hesitate to contact any of us. And then we will be posting the recording for this webinar in a few days on inewstudentwebinars.ucsd.edu. Once again, thank you all so much for joining us, and I hope you have a great rest of your day.